Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about that well worn out, Lord knows it's been discussed way too much, issue of masks. And this has everything to do with a new study and a new update put out by the Annals of Internal Medicine. And I've contended all along that masks really, if anything, they help a little bit in certain situations. But there are many people who think that they're following the science and think that if everybody had masked, this would have been over. And clearly, there is nothing that would suggest that that is even close to the truth. And I think I would make the analogy of artificial sweeteners. And at the surface, it seems like if we could just put in less calories, we'd wipe out obesity and diabetes. The obvious answer is that, if anything, they probably have made diabetes and obesity worse. Clearly, it's not better since we started using artificial sweeteners. And masks are much the same. Like, there were in some areas there were high compliance, and it didn't make one squat of difference of overall spread in the real world. So keep in mind, we're not talking about modeling studies, because those have all been largely false. Like, I would take a real world study over a modeling study any day. So if you see a thing with a mannequin and this is where, like, that's all relatively worthless. And we've seen that time and time again when it comes to COVID, as opposed to real life data. And a lot of times the real life data flies in the face of what we see in a modeling study. So the first thing is the Annals of Internal Medicine, which is a well-respected medical journal, have now done 7 updates over the course of the past 2+ years, looking at new data that's been added in masking. And they look at both a community setting and healthcare setting. I haven't really talked much about healthcare setting, certainly less of an issue. Really what we're talking about is wearing a mask when you're asymptomatic and walking past somebody in the grocery store with the concern that you're going to kill their grandmother. Like, that's taking everything. But there's people that really believe that that's what masks do and how they protect. So the data in Annals Update 6, the data was low that masking in a community setting might have an impact. Again, the data, this has to do with the quality of studies, data was low. So the only thing they added in this last one was the Bangladesh mask study. And it brought the evidence from low to low moderate. So really it just kind of sucks. And the Bangladesh mask study found that cotton masks didn't do squat, and surgical masks only helped in those over 60. And there were some concerns with the study. So really, the only study they added in didn't really make anything exciting change with our knowledge of masking. And yet, despite this, people, I really think that the people that think masks could have changed this around have not actually looked at the studies or even had somebody sit down and interpret the studies with them, because you might not know how to look at medical research, but certainly there are more than enough videos, mine included, that have broken down the data and shown where it was not saying what people thought it was saying. And I find that most people, gosh, doctors included, get their information from the media. And the media is, or worse, the CDC, which, oh my gosh, that's been certainly controversial because they've used a lot of modeling studies that just, you've got the CDC study over here, and every other study looking at it runs opposite of what the CDC may say, and they just still are continuing to do that. So so I find that most people who think that masks could have changed this are not actually reading the studies. They're going by what somebody told them or what the media might have told them. At best, I would readily admit that maybe universal masking with high compliance led to maybe a couple percentage points difference in community spread, if that. Contrast that with sunlight exposure and vitamin D and exercise and dietary changes. The things we haven't talked about would have a massive change in outcomes. And so, again, we're arguing about the one thing that has a minimal effect and ignoring the things that clearly do have an effect. So all of this, I've pointed out that real world studies are always what I prefer. And one of the challenges with some of the masking studies is that they were done, I wouldn't say cheating, but they were designed to show a benefit. In other words, if we have cases are going to go down regardless of what we do, so consider seasonality. So we've seen through the years now that in March, April, May, numbers seem to drop down for the summer. And so if you do a study on masking in March and numbers start going down, you're like, woohoo! And yet the reality is, you just did it at a time that was convenient for you. So this group looked at masking across Europe from October 20 to March 21. So all the time when numbers were starting to go up and staying up, this is when they looked at mask usage. And they looked at it for mortality. And so basically, was it preventing deaths, which is what we really want to do? And they found pretty much zero correlation between mask uses and death in 35 European countries. There might have even actually been an indication that masks had a somewhat of a positive association, so more masking might have led to more mortality. Probably just an artifact, but so I wouldn't suggest that. But clearly, they didn't make a difference in mortality. So all of this frustrating, like the amount of energy that has gone into discussion, if you will, usually to arguments on masking, and we've just completely avoided the things that we know will work without a downside. And still, years later, we're still not talking about taking better care of ourselves and immune system, which is just flat out, at this point, it should be, I don't know, I don't even have a word for it. I'm so disgusted with where we're at and the lack of education about taking better care of ourselves. There's no word in the English language that describes it for me. So as always, I'll post a link to this particular study in the description, studies in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.